Critical care nursing, prone positioning in ARDS patients. It is important to note that prone positioning refers to a technique that is utilized to improve breathing in patients with acute respiratory distress syndrome, ARDS. It is stated that in prone positioning, patients lie on their abdomen in a monitored setting. Prone positioning is generally used for patients who require a ventilator, breathing machine. In other words, it is opposite to supine positioning, which is the most common way of positioning since patients usually lie on their backs. Guérin et al. Found that the prone position is generally accompanied by a marked improvement in arterial blood gases, which is mainly due to a better overall ventilation and perfusion matching. The main reason is that the heart stops applying pressure on the lungs, which enables less compression of the lung tissue. In addition, the dependent lung regions undergo fewer cyclical closings and openings, whereas the non-dependent ones do not become excessively overdistended. As a result, patient outcomes can be drastically improved by placing patients on their stomachs. In terms of mortality, prone positioning has shown positive results. Evidence suggests that when patients are prone and positioned for 17 hours, they have from 15% absolute to 25% relative critical care mortality rate reduction. Therefore, there is a decrease in the mortality of ARDS patients when the measure is applied. In terms of morbidity, the illness becomes less severe due to lower levels of lung injury and enhanced oxygenation, which means that ARDS symptoms become more manageable. In addition, Weatherald et al. Found that awake prone positioning compared with usual care reduces the risk of endotracheal intubation in adults. Thus, both the state of illness and the rate of death are improved by prone positioning. However, there is an important multidisciplinary element to the initiation and management of prone positioning. A physician should initiate prone positioning within the first 48 hours and not as a rescue therapy for the measure to be effective. The duration of the prone positioning needs to be longer than at least 12 hours. As a result, a critical care nurse plays a central role in both the initiation and continuous management of prone position patients. Since most physicians tend to use prone positioning as a rescue tool, nurses need to be aware of the critical condition indicators of patients. Informing physicians about the need for prone positioning early is important on the nurse's front. Nursing professionals' roles include patient assessment and monitoring, managing potential complications, coordinating the repositioning process, and providing emotional support to patients and their families. The former refers to continuous observation and recording of vital signs, oxygen saturation levels, and the patient's subjective experience. Regular checks of the endotracheal tube and ventilator circuits are necessary to prevent accidental dislodgement or obstruction. Coordination of the repositioning process requires effective communication and teamwork skills. Turning a critically ill patient from supine to prone and the other way around is a complex procedure that involves multiple healthcare professionals. Being in a prone position can be uncomfortable and anxiety-inducing for patients. Nurses need to provide reassurance, explain the procedure and its benefits, and involve the patient in decision-making when possible. Therefore, the implementation and effectiveness of prone positioning are highly dependent on the skills, competence, and collaboration of the nursing team.